Students across Colorado are catching up from the pandemic learning loss. For some, it goes beyond education and their mental health is suffering, even in some of the youngest kids. Joining us now is our social equity expert, Dr. Rosemarie Allen. Good morning. Thanks for coming in.
Good morning. I'm glad to be here.
This is so interesting to be talking about little kids. So what are some of the ways that infants, toddlers, and preschoolers have been impacted by the pandemic?
Well, you know, early childhood mental health, it really promotes social-emotional development. It helps children self-regulate, manage those difficult emotions, and really bond with caregivers. And when that process is disrupted, for instance, during the pandemic, then it disrupts those processes and they have difficulties in just learning and exploring their environment and bonding with caregivers. And what we see is that adults sometimes have challenges in addressing some of these issues. For many infants, this is their first time being cared for outside of the home. And for preschoolers, they may have new teachers, new classrooms, new environments, new schedules and routines, and it requires a period of adjustment, and it can be very challenging for adults and for children.
It looks so different today than it did just a year or two ago. And this is so interesting that we're talking about little kids. What does this look like for, infants and toddlers?
You know, for infants, we may see crying, excessive crying, and they become inconsolable. They may lose previously acquired skills. They may not want to be held. They may have serious separation and anxiety. They may be fearful of other adults. They may not attach and bond well. We see sometimes even language loss. We see that they're not babbling or using words that they should be using, that's appropriate for their development.
What are the signs that a child may need some support, some extra support?
And those are some of the signs, but when these become extreme and it interrupts the learning process, and families usually know, they can figure that something is wrong. They may not want to be held. They may have these eating and sleeping difficulties. And again, losing those skills, that's when you really want to seek attention. If they were babbling and stopped, if they were toddling and walking a little bit and stopped, you want to make sure that you seek help for that.
Where can parents go for help?
We're very lucky here in Colorado. We have early childhood mental health consultation that is actually at no cost to all caregivers taking care of children up from birth, even prenatally, to 6 years of age.
Wow, that's a great resource.
Really amazing. And these mental health consultants, they have deep expertise in early childhood, child development, mental health. We come to wherever you are, the mental health consultants do, and there's a hotline that's available. You call when you need help. Help is available. We want to make sure that we're promoting healthy social-emotional development so that children can thrive.
This is so great we're talking about this because, often we talk about adults or older kids, but obviously all age groups are impacted. So I'm glad you kind of highlighted that today. Yes. Dr. Allen, thank you for coming in.
Thank you.